Welcome everybody to the back pain virtual workshop. I'm so excited to have everyone here on this. Dr. Kamran and I have been talking about this for a long time and we're finally doing it. So we're so excited to share this with you all. And so as some of you know, my name is Dr. Matthew Perry, physical therapist and owner of Auto-Ness Physical Therapy. And here we have Dr. Kamran.
Nice to meet you all. Dr. Kamran Jahangiri. I'm owner of ST Chiropractic Neurology, or one of the owners.
Great.
Thanks for having me, Matt.
Oh yeah, excited to have you here. And so what we're going to be doing today is really having a good mix of flavors here, with the chiropractic discipline, with the physical therapy discipline, and how some of these things work together. And I'm just over the moon with it and cannot wait to dive in. So let's do it. Of course, before we start, we have this, that this presentation is for educational purposes only. Please do not do anything that hurts because we haven't evaluated, well, some of you, and we don't know what's going on. We're not trying to treat, cure, diagnose any disease or ailment on this workshop. This is purely for informational purposes. Okay. Seriously, we have no way of knowing what's going on with you. If anything hurts, don't do it. Okay, feel free to ask any questions, of course, and we want to make sure everyone's participating, but participating safely. Of course, can I get a thumbs up from everybody? If you understand that, thumbs up, nod, any of the above. Thank you all so much. Appreciate it. Let me just make sure we don't have any other stragglers coming in. Okay. Great. And this workshop is being recorded. As I said, we're going to be sending it to everybody who signed up and attended this workshop, so you can share it. I know some of our clients wanted to share it with their loved ones, and we want to spread the knowledge as best as possible. Okay, before we start the actual talking about the back, we want to talk about growth mindsets and fixed mindsets. I'm sure a lot of you have heard of growth mindsets and fixed mindsets, but let's just go over it real quick. Fixed mindset: intelligence is static, leads to a desire of wanting to look smart instead of, really understanding and learning. In the fixed mindset, we avoid challenges, and ignore feedback, all of those kind of things. Whereas with the growth mindset, we embrace challenges. We want to learn. I hope to learn a lot from everyone who's on this call, hopefully as much as you guys learn from us, okay? So we want to make sure everyone has the growth mindset hat on today. And so I'm just going to go around. I want a thumbs up if everyone can put on their growth mindset hat for the purposes of this presentation. I know most of you already have it on, always and forever. Great. So objectives, we're trying to identify some of the causes of back pain, maybe some effective treatments for back pain, strategies to prevent back pain, because that's the goal, right? We want to try to prevent and not always rehabilitate. And of course, answer any questions that you all have. Again, for those showing up late, if you have a question, just please unmute your mic and say that you have a question about something. We want to make sure it's valuable to you and that we're answering everything. If you put your hand up, I probably will not be able to see it based off my screen right now. Just to let y'all know. Okay, Dr. Kamran's going to take this slide, the back.
So just some fun facts for you guys to learn a little bit more about the back. Like it says, leading disability worldwide is caused by the low back. So many people miss many days of work or activities due to this type of injury or just chronic disability. It's the amount of people that this is impacting is increasing year by year. So the last 15 years, there's been an increase by 54% with low back disability. 80% of the population will experience back pain at some point in their life. So it's not a matter of when, it's just a matter of when, but not if, typically. $50 billion in healthcare costs per year. So it is one of the most expensive costs for people to be dealing with, one of the most expensive ailments.
Yeah, is that are some of these stats staggering to anybody? I mean, I know most of the people, I know some people are shaking their head, it kind of makes sense. But that is a lot of disability, a lot of prevalence with low back pain. It is pervasive, and as Dr. Cameron said, it's just getting worse. So, what do we do to help with it? First, we got to go to this anatomy, though, which Dr. Cameron will take.
So, just to give you guys a little bit of a foundation to work with, we've got a spine. And as you can see on the slide, you can see those bones, and this is a side view of the spine. And in between each of the bones is the little gel intervertebral disc. It's got a bluish color to it, right? And those discs sit in between those bones, and they provide some compressive, or they're able to handle compressive load. Okay. In tandem with that, we've also got curves in our spine, and each area of our spine, our low back, our mid back, and our neck all have certain curves that they're supposed to have. And when things are in good alignment, that actually acts as kind of like a spring to help with those compressive loads as well. So when things are in good order, we're able to handle all those forces. When things shift away from normal, we might see some shifts as well with what we feel. In between those bones, behind those discs, are those yellow wires. Those are actually nerves. And those nerves sprout out from the spinal cord that sits inside. It's encased by the spine. Okay. And not labeled on here, but we have a lot of musculature that sits around the spine to help it keep it stable as well. It helps secure that stuff, keep it in a strong foundation so that it can handle all the dynamic movements we go through day to day, and also the static ones that we do, whether we're someone who sits for long periods, stands, whatever it is our activities require. All that making sense? Good. Any questions about the anatomy so far? Okay, great. So with the spine, we've got small muscles that attach, and those are what we call our paraspinal muscles. And then we've also got really large ones. And typically, as our posture changes and as we age and all those things, those smaller ones tend to get smaller for most people, especially if you're somebody that experiences low back pain. And then those larger ones start to recruit and they start to become more active and spasm. And that's where people can start to experience certain tension patterns and knots in their back and those kinds of things. Does that make sense? Okay. So Matt, do we maybe want to go to the next slide, or do you want me to dive into some of these other?
No, I think
maybe the
that
transverse
was,
abdominis.
Yeah, maybe a little bit about the TA.
Okay, so we've got those. So let's start with the top. Actually, the multifidi. Those are those smaller ones that attach to the spine. They help secure it. Sorry. Okay. The quadratus lumborum actually is the one that just is sitting on the side of the spine and also helps, again, secure it to the pelvis. Okay. And then some of your ribs. And then we've got the transverse abdominis, and that acts as what's called our abdominal brace, or it's kind of like a corset that sits around our trunk and helps secure that whole thing. It's one of the most important muscles we have in our back or in our trunk.
Huge, hugely important.
Yeah, I can't stress that enough how important that muscle is.
Yeah, we'll talk about that in just a little bit, just how important it is.
And this is just a better view of some of those muscles. So you can see in the red, I believe that's the quadratus lumborum. And that's like, you can see attaching into the ribs, attaching to the spine, into the pelvis. It really helps you secure and stabilize that spine from what we call lateral load, and then some rotational types of load. And then we've got all those other muscles, the multifidi that are attaching in as well, and some of the other paraspinal muscles, the longer ones that go from the low back and the pelvis all the way up into the upper back. So sometimes even stuff that's happening in the low back can be impacting stuff that's up above, because those muscles travel the length of the spine.
And and when we talk about the low back, we can't neglect the rest of the spine, right? Everybody. And so that's why I have this picture here, about the cervical spine, thoracic spine, lumbar spine, sacrum, and coccyx, right? It's all connected and it's all a unit. And Dr. Kamran and I have some colleagues that only work with the upper cervical spine, and it's amazing what happens when up here falls in line, how the rest of the back can optimize. So.
So now on this slide, we've just got a few different types of injuries that can happen in the spine. These aren't necessarily just specific to the low back, but they can happen anywhere. But the low back is one of the most common places where these things can pop up. At the top, we've got a herniated disc, and a herniated disc, essentially that jelly in between the bones. That disc is kind of like a jelly donut. Okay, the outside is like the crust, and the inside is that jelly filling. And sometimes the crust can get a little torn or injured, and then allow that jelly to spill out. And typically, reasons for that happening are because the compressive loads exceed how much that gel or that donut can handle. So in the beginning phase, that herniation will pop out, or that little gel will push out, and it can sometimes impinge or make contact with the nerve that sits right there. So maybe you can show or point to some of the nerves. So that's the jelly popping out, and then that's the nerve on the outside that it can start to push into and irritate, and then we can end up with symptoms there. As this thing heals up over time, it usually doesn't heal up properly, and most people aren't even aware that they have herniated discs as they go over time. And these things they can lead to the injury getting worse over time and progressing and turning into what's called a disc bulge. And now it starts to hit more surface area. That jelly starts to push out in multiple areas. And then eventually that starts to shift into what's called a degenerative disc. So that disc starts to really flatten out. And now those spaces in between the bones, they really flatten. And the bones our body is really smart, and what it's going to try to do is lay down cement or new bone to try to secure that area, because it's gotten so unstable, because things have gotten so injured in those areas. We've also got other types of injuries like sacroiliac joint dysfunction, spinal stenosis. That's a really big one. That's where the spaces where those nerves sprout out, the holes can get a little smaller. So that's what stenosis is. And that can happen in the spinal cord area too, where that has a hole that it goes through in between in the spine, and that can start to enclose as well, or start to get obstructed. Spondylolisthesis, another really big one. This is more instability in the spine. So when things get too injured, it's almost like having a sprain in the spine, and things start to move around more than they should. And that's never ideal, because if things are moving around, that again, we have those nerves in the spinal cord sitting in there, and you can end up having the bones kind of creating irritation in those structures. And you can end up with a lot of symptoms, a lot of severe pain from that kind of stuff.
No bueno.
No bueno's right.
So this is an interesting study. It's getting a few years old now. We need to find some new ones. More people need to be doing research. But this is a percentage of abnormal findings on a lumbar spine in people who are healthy and pain-free. Okay, I'm going to say that again. These are abnormal findings in someone's lumbar spine in people who have not experienced, or at least reported, pain in their back. And so what I want everyone to see is 20s, 40s, 60s, 80s. As we get more, um, uh, get older, we are going to have some changes, right? That's a, want to call it the beauty or the fault of living a long life, right? We know that almost 100% of people are going to have some degeneration. That's DEGN here, disc degeneration. A lot of people are going to have bulges too, okay? But again, these are very healthy and pain-free individuals. So what I really want to illustrate with this slide is that, there might be a lot of people who do have pain, but there's a whole lot of people who have abnormal findings and do not have pain as well. Does that make sense to everyone? Can I get a thumbs up if that makes sense, or a nod? You're following me? And of course, any questions about any of these slides, please just blurt it out. Because it's important, and we obviously don't want to minimize anyone's pain who does have issues, but we'll get to the bottom of that in a little bit. And here's a cool slide from a study. What they did is an EMG study, which was cool because they actually took a probe. I wouldn't want to be this person. They actually put it in their back, and in this case, it was the third lumbar disc. And so, instead of a report, someone saying, "Do you have pain or not?" This was actually measuring the actual pressure in the low back. And so, what everyone can notice from here is that when you're laying down, you have not much load into your back. When you're lying on your side, a little bit more, but still fine. When we're here, standing, it's, a little bit more, but we're designed to stand. We're designed to be in those positions. And I can tell you, or I can show you better than I can tell you, because as we start bending over and getting more towards these slump positions, to here, who here's ever been in this kind of position before? This is kind of slump sitting. I like to call it, for those who are working, that 5 o'clock on a Friday posture. You're kind of just hanging out like this, right, at your desk. Maybe you're working on a long project. Same thing. This puts a ton of load into our back. And it's not saying that this position is bad and no one should ever do it even for a second, but it's just illustrating a point. Most of us are in some of these positions for a long time, right? You are sitting, reading the paper, hunched over. Then you go to sit and watch some TV, hunched over, maybe even reclined back. But we're in this. Most of you are in this position for most of your careers, based off the kind of demographics of the audience. So again, not that any of these positions are inherently are bad for us, but prolonged periods, we do not want to be in them, ideally. Do you have anything to add on that, Dr. Kamran?
Oh yeah, just like you're saying, these posture can really impact things over time. It's one of the most common traumas I see for spinal injuries.
So, as all of our parents have said throughout our lives, stop slouching.
Yeah,
right?
No joke. Still rings true.
Still rings true. I could always be better at it too. So, but it's important just to be aware of it. Okay, Dr. Kamran, let's take this slide.
So we've got a number of different types of injuries. Again, just kind of covering some of the other areas outside the spine. So we've got muscle spasms. A lot of you probably experienced that. I know I have myself, when the muscle gets really clenched up and guarded, and then you end up with a potential pain wherever that muscle is, or just limited range. We've got injuries to our ligaments versus muscles. So with our muscles, it's a strain is what we call it. And those can have mild tears, moderate tears, or severe. Those have different grades. And same thing with a sprain. So a sprain would be like a ligament or a tendon. And these things are what we call white tissue. And those can also have different grades of tears or injuries. Okay. And then finally, we've got other types of injuries, like infections can impact different tissues, which is not ideal. Tumors on occasion can be another source of injury or low back pain or whatever it might be. And then we've got piriformis syndrome, where the muscle can actually spasm or get tight, overactive, and then potentially impinge on another structure like a nerve, like that sciatic nerve that travels down into your leg. It can give you that type of numbness, tingling, and shooting.
And who here has heard of piriformis syndrome before? Okay, got a few hands. Would someone like to be brave enough to unmute themselves and tell me what they feel piriformis syndrome is, or maybe their personal experience with it, if they feel comfortable? Mary, yes.
Yes, I can say a few words. From dance injuries, I've had a couple of serious ones, and I also have problems with the angle of my sits bones. So I get a lot of pain on the sciatic nerve, in the piriformis area. And sometimes it's a pain sort of running down my leg, and it affects my stability a little bit on my left leg because I'm a dancer. Ever since the second injury, I'm nowhere near as strong standing on one leg in high heels on my left as I am on my right. And then I also get just a terrible burning in that area, just even sitting. I mean, the most comfortable thing is for me to stand. Sometimes I have to kneel down rather than sit if I want to watch the television, but that comes and goes, and I have some specific exercises for it, but it's a chronic thing.
Understood. I really
Right.
appreciate you sharing. And looks like you're in great hands and everything. So that's really important, right? Because what I wanted to kind of bring up, and thank you so much again, Mary, for sharing, is piriformis syndrome. What is the piriformis? As Dr. Kamran said, it's this muscle here. But what does syndrome mean? Syndrome means it can be a whole lot of things. It's a collection of a lot of or an umbrella for a lot of different conditions. And so why it's really important that you make sure, which you are doing, Mary, to get specific help, getting to the bottom of why that piriformis is getting tight, right? Because we could all probably safely agree, come to the conclusion that your body doesn't do a whole lot on accident, right? It doesn't wake up one day. You don't wake up one day and say, your body says, oh, today my piriformis is going to be tight, right? There are causes and symptoms and different things like that that are contributing to this syndrome. And so, we have people in the clinic maybe who have, some thoracic spine tightness that's here as we went over, who then get, come in with the piriformis syndrome. Well, if we loosen some things up here and the body gets in better alignment or what have you, guess what? That piriformis loosens up. And so sometimes it is the piriformis for sure. But just saying that, oh, it's a piriformis syndrome, that's not, as specific as it can be. And so I'm sure you have some comments on that as well, Dr. Kamran.
Yeah, sometimes another thing to think about, like you're saying, just kind of trying to figure out, because it is an umbrella term, and there's some overlap with what could be happening with the sciatic nerve, right? Because originally the sciatic nerve actually originates from the low back, right? And the sacrum of the tailbone. So all those branches start out by themselves, and then they form this big rope, which is the sciatic nerve, and it goes and travels down the back of the leg into the foot. And depending on where the injury might, or where that signal is being impeded on, or where the irritation is, it can give you a sciatic type of presentation. So there are actually a number of different spots where you can end up with sciatica. And like Dr. Matt's mentioning, it can be from the piriformis, but it also could be coming up from higher upstream. So it's good to make sure that you're having somebody thorough evaluate and turn over all those stones and not just chuck a box protocol at you for piriformis syndrome and just give you a stretch, that everybody gets. Yeah, it's good to do that detective work.
Absolutely, absolutely. And so I want to quickly, go over this because, it's a lot of what we just touched on. It's about finding that actual cause, right? Not just chasing the symptoms. Because if the problem was never in your piriformis, maybe it was upstream, you're just going to be doing the same thing every time, looking for a different result, right? So we don't necessarily want that. You want something more specific. Also direction of preference. There's a lot of schools of thought saying that if you do have pain, in one direction with your back versus another direction, that can significantly influence the treatment that goes about that. And then restoring range of motion, which Dr. Kamran does an amazing job on and has with some of our clients, by really decreasing the muscle tightness in a very specific way. And then we got strengthening, right? That's a little bit more some of our area, with really making sure that not only are the muscles strong, but they're coordinated. They're working when they need to be working, or else you are going to continuously throw out your back every single time you pick up that pencil that you dropped on the floor. So everything has to be working well and in unison. Making sense, everyone?
So in tandem with what Dr. Matt's describing, some of the other key things that we like to make sure we touch on when we're working with patients that are dealing with these chronic injuries. Everybody is probably familiar with that. We need blood flow for tissues to heal. Yes? All right. So it's really important that we have good blood flow wherever a possible injury site might be to allow it to heal. That makes sense. So one way that is an easy way in with that is red light therapy. I don't know if any of you have ever heard of red light therapy, but it has been shown to help upregulate circulation in the area and then also speed up tissue recovery. So we really like red light therapy wherever an injury site might be. And then the other added benefit of that is that we can potentially relax some of the muscles in those areas in case we have potential spasms or we're having muscle imbalances from, posture imbalances that we have, like cross syndromes and stuff. The other thing more specifically, as we go back to that image of the spine where we had the nerves that were sprouting out of the bone, and sometimes when things get too compressed in there, those nerves can get impinged on. So sometimes because these nerves they run on electricity, one of the ways that you can actually help them recover from injury is by stimulating them properly. And this is a little bit more than just using like a TENS unit, like most people can go get at CVS and just putting the pads on, because that's only going to hit the superficial nerves that sit on the skin. There are different types of electrical stimulation out there that are more like the Tesla of electrical stimulation that can go all the way to those nerves that go into the spine and then back out and potentially start that repair process or help with the recovery of the nerve if you are dealing with like a sciatica or some other type of nerve injury. In tandem with that, I'm a big proponent of decompression of the different spots in the spine and potentially the hips as well. Like Dr. Matt was mentioning, range of motion is really key, and mobilization of the areas that might be involved. And just making sure that there's full range there is ideal so that you don't have abnormal muscle contraction and possible irritation of different tissues. But also because the spine, again, can get so compressed and those discs can get so flat, we like to create a little space so that potentially can take some of the load off the nerve and allow it to set you up for a recovery to where you can strengthen properly in that area and not have it get irritated when you're doing those kinds of things. Finally, another thing that I really am a big fan of is brain down control. So one of the main areas of our brain that actually controls our posture is our inner ear. And that's a really important area for our brain because it helps us with balance and coordination, or just sensing movement and having better awareness of where we are. And sometimes we can leverage that system to help activate the muscles that help us with postural control. So if you're somebody that's dealing with chronic low back issues, in tandem with doing like a strength training or stability type of program, you can add in some vestibular work or some brain exercises, and that can help with trying to get those muscles active and prime it for a successful strengthening program.
Any questions so far? Don't worry, we're gonna get moving in just a second. No questions? Again, if you're typing to the chat, I might not be able to see it. I don't know why my screen's not showing. Okay, how to protect your back. That's what we're probably mostly here for, right? Ouch, Matthew, it hurts. Make it not hurt anymore. So what was that, Cameron?
No, I just got a little laugh out of it too. That is funny.
Yeah, exactly. You know, so there's a lot of different ways, a lot of different things that can be done to the back. But we want to make sure we leave you guys with some like just tangible, easy stuff, by the end of this. So what we call our back, the back, Auto-Ness is the core set, okay? Because people talk about, oh, my back hurts, so my back's weak, my core is not, not working. Okay, great. But what is the core? And actually, I don't want to pick on anybody, so I'm going to have somebody unmute themselves and explain to me what they feel like the core is. Come on, don't be shy. I don't have to pick on somebody. Mike and Barbara, I'm going to pick on you. What's the core?
Thing down the center.
Barbara's talking.
Thing down the center. What was that other part?
He was just pointing out that it was me, not him, in case I was wrong. It looks like I'm the soda can.
Yep. It's your midline. Perfect,
Yeah.
Perfect answer. Thank you so much. I appreciate it. I knew I could pick on you guys. Yeah, exactly. It's your midline. It's your sense of stability. Okay, we have a lot of abdominal muscles, that go every which way, this way, this way, this way, and around. The muscle we were talking about before, that transverse abdominis, is one of the muscles that go around. Okay, and it actually intertwines with some of your back muscles. And when we're bracing our core, guess what we're doing? We're creating a nice ring around our center. That ring is almost like the weight belts you see, or the belts that construction workers use, when you pass by a construction project. It is like that, except the one you have internally is custom for you. It works better than any back brace that you could ever buy, at least for most of us. So within that, we're not only creating this ring, but we have our ceiling of our core, which is our diaphragm, and the floor of our core, which is our pelvic floor. And guess what? When we brace our core, not only do we have this ring, but we have my diaphragm, primary muscle of breathing in, distending, coming down like this, pelvic floor down here, you probably can't see, coming up. And so it does this and this. Okay, that's what gives us that stability. So instead of the load going into our back directly, it actually is able to go through our back. All the forces translate. Okay, so I know it's kind of a little high level. We can also talk about the glutes. You could extend your core probably from your little toe up to the top of your head. Really, but Cameron, Dr. Cameron, I don't know if you have anything else to add to that. It was very high level, quick approach, but
No, nothing much. Just like like he has with the can there, you can see how the lid's popped open, right? So that's like if you got nothing in the can, that can's gonna squash pretty easily, right? But if you have that can full and it's sealed up, it's gonna be able to hold a lot more load. You'll be able to step on it and probably won't be able to crush it or anything like that. So it's similar with our body, that core set. When we increase that pressure with the diaphragm and we get that brace going, you can keep that pressure in, and then your body can handle a lot more, like exponentially more.
yes. So be that closed can of soda, that shaking can of soda, right? You try to
There you
press
go.
on it and then presses back out at you.
You got it.
Perfect. All right, I'm gonna skip over this because I want to get moving, everybody. I know that's what a lot of you came here for. Okay, we'll maybe circle back to the other stuff, but I know you guys want the meat of this, which is the corrective measures. And so Dr. Cameron's going to talk about a couple things, and I'm going to talk about a couple things in this slide.
Okay, so we've got gua sha at the top. I don't know if any of you have ever heard of gua sha before. It's basically a tool that's meant for soft tissue. When I say soft tissue, I'm talking about things like muscles and other like tendons, ligaments, that kind of stuff, okay? But we're mainly going to be applying this tool over muscles, and we could give you a link for this after the class, just showing you where to get something like this. But you could even use a spoon, whatever has an edge that you can work with that's blunt, okay? Not that I'd recommend, I'd prefer a tool, but if we're working on because one of the issues that we have when we have these, when we're having low back pain, is that we're sitting in posture all day that starts to curl us forward. And then certain muscles that we shouldn't be using start to create strain on the spine and can create pain patterns there. So if we can get some of those muscles to loosen up that are overactive, it can help with putting us into better posture and then make it so that our spine can handle better load. So I'm going to help you. I'm going to show you one of the muscles through the front actually, and I'll get to one through the back of the leg. But if I'm working through the chest here, I'm taking the tool and I'm just moving from midline out, and I'm just only applying about 20-30% pressure, nothing too crazy. It should be comfortable. It shouldn't be too painful. You're just working midline out, okay? And just imagine it like you're squeezing some toothpaste out of the tooth tube, or the toothpaste out of the bottle, okay? And you're just trying to get that last bit out and just moving it out, okay? Similarly, if I'm gonna work on some of the other sitting muscles, like my hamstrings, I'm gonna work through the back of my leg. Okay, and you can do this seated too, and just grab the tool and just work it through and just get some of these to relax. And what this is going to do is going to get the muscle to tone down, and then it's going to make it easier for when you go do a stretch, like some of the ones that Dr. Matt might recommend, or some that you might be already doing. Does that all make sense? Okay, awesome.
That's perfect. And why I feel our practices work so well together is, part of this is what we like to say: you gain the range and then you train the range.
There you go.
Yeah.
Love that.
I'm full of them today. Just wait till you hear the dad jokes.
Take a range check, man.
Okay, yeah. I'll spare y'all. So what I have, I brought my laptop down, use my room with the baby stuff. But I want everyone to stand up who feels comfortable. We're going to go over a good morning. This is how we train that range. So this will actually be training the hamstring example that Dr. Kamran had. So I want everyone just make sure you got a little bit of space. It's not going to be too intense, everybody. But I want to make sure you're really grounding yourself to the ground. Okay, make sure you're on a nice stable, like when you're on the ground, I want you to kind of dig into the ground a little bit, get a little bit of stability, kind of get set. Okay, you don't know what I'm going to do, but it looks like I'm about to do something, right? I'm not just standing like this. Okay.
Do you want to expand your video maybe?
Expand the video. Yes.
It might be a little hard for them to see right now.
Yeah, maybe stop the share.
Yeah, just for a second.
Yeah, good call.
That'll probably help.
Thank you.
Uh-huh.
Thank you. Okay. So now we're nice and grounded. And so what we're going to be doing now is I want you to think about bringing your ribs up here down. You see what I just kind of did here? I'll do it again. My ribs down. Okay. And then I want you really bracing here in your abdominals. Okay. Kind of like best example I have is if someone, one of your friends is going to flick you in the stomach here. Okay. And so with this position, all we're doing is sitting back like so. And I want you to squeeze your butt to come up tall. Again, and I'll give you a front view in just a second. Here, squeeze your butt to come up tall. Okay. Try to keep a neutral head so you're not doing this, because if you look at my back, as I look up, my back arches. I want a flat back. So I'm here, I'll just get my hands out of the way. You see how you can pretty much put a cup of water on any part of my back right now? That's what we want. We want nice flattening. What you should feel is a lot of tension build back here in your hamstring region. As you come down, sit back a little bit and squeeze to come up. Is that making sense, everyone? Yeah, let's do a few. And I really want you to make sure that you're sitting back, okay? Notice here my knees. I sit back. My knees bend just a little bit, but I'm not bending my knees this way. It's because I'm sitting back, okay? That's just a little bit of what we call neuromuscular re-education. Starting to get your abs working with your glutes, working with your hamstrings, everything kind of working in coordination and conjunction. Does that make sense, everyone? And I want to actually have everyone still stay standing, and we're going to do a mini lunge here as another exercise. So take one foot back. We'll say take your right foot back. Give yourself a little bit of space. Hands on the hips. Again, bring your abs down into this position. And just a little bit. I'm not asking you to want to do a full lunge. I just want you to come down and up. Down and up. I want you to try to have maybe 70% of your weight on that front leg and then maybe 30% on that back leg, because that's going to really activate this glute on this front side. Here. Also notice that my knee might be traveling forward maybe an inch or so, but I'm not doing this. I know it's called a lunge. It's a bad name, I think. I'm not doing that. My knee or my hips are pretty much dropping straight down and then coming up. Okay. And do it, to your tolerance, to your range. But anyone with knee issues, if you're not bringing your knees super forward, it'll probably feel a lot better.
Do you have any recommendations on a good hip flexor stretch? Because I'm not sure if a kneeling lunge is a good idea.
Yeah, I got you.
Right.
No problem. Okay. So for the hip flexor stretch, what we'll do, pretty simple. I know we did the, actually don't worry about which leg is back or forward, because I'll just kind of show you from here. Okay, what we're gonna do first is I want you to tuck your tail. You see how I'm here? Tuck your tail. And so in this particular place, I'm going to be stretching my left hip flexor. So I tuck my tail, and I like having my hands here at my waist because I'm almost using my thumbs to kind of guide me forward. Slight bend in the knee, maybe. Again, thumbs here, kind of guiding me forward. Okay, we can hold that for a moment and then come out of it. I like the idea of dynamic stretching. So we can then go back into it, hold it maybe, 6 to 10 seconds and come out, and then go back into it, try to get a millimeter further if you can, and come back out. Okay. And of course you want to do all of these things on both sides. I told you I was going to give you the front view of the good morning just real quick before we move on. So we have the good morning here. We have the front view of the lunge. Notice that my knee stays nice and stable. It's not turning in, it's not turning out. It's just nice and stable in all planes. And then we have the hip flexor stretch with my thumbs kind of guiding me forward. Does that make sense, everyone? Any questions on those? I know we went through them kind of asynchronous, but.
Nice job.
For sure, for sure. All right, let's. So yeah, again, that was the good morning. That was the lunge, and then the hip flexor stretch.
Stuff.
Yeah. There's more.
So would you mind sharing my screen? Maybe blowing it up a little bit?
Let you share your screen? Is that what you said?
Yeah. Do you mind making my screen big?
Yes.
Cool. Is that working?
Yes.
Okay, cool. All right. So this is a brain exercise that you can do that will help actually with balance and also help with getting that core activation. All right. So it's a simple little brain trick. So what we do is I want you guys to, by my side here, you're going to take your hands, cross them together. So link them together, and then have the thumbs stacked on top of each other, but you're going to have two thumbs up. Okay. Everybody got that? And we're going to have that out here like this. Try to have it at a comfortable range that doesn't hurt your shoulders or your neck. Okay. And what you're going to do is you're going to keep your eyes on the thumbnail. Okay. The one that's pointed towards you. And then what you're going to do is you're going to be keeping your eyes locked on it and move your head left and right. And we're going to go back and forth with this for about 10 reps each direction. So 1, 2, 3, and so on. Right. And what that's going to do is the brain's going to start sending signals down to start contracting those paraspinal muscles, those long muscles that span the whole spine and help it engage. Okay. It's also going to help with that core. All right. The next one you do, similar variation, you're going to have the thumbs up, and then you're going to be moving your head in the yes, yes pattern, just backward and forward, chin tucked and back. And we don't want to be moving through any painful ranges. So if you get any pain with it, just find a range that's comfortable for you. Okay. And you're just doing that yes, yes. Same thing, 10 in each direction. All right. And this one's a little more potent in engaging your posture. You should feel more upright after you do this. Now, with this exercise, we're not, if you have any dizziness issues or vertigo, I would not recommend doing this. You definitely want to continue to work with any specialist that you're seeing to work on your vertigo and make sure you remedy that before you do an exercise like this. Okay. But if you're no dizziness, no vertigo, then you can have at this. Should be no problem. Should just help you with your posture and your muscular control. Okay.
Great. That was a awesome exercise. And I'm someone who was actually a patient of Dr. Cameron's going on a year and a half ago, something like that, for my vertigo. And yeah, that was some nasty stuff, but Dr. Cameron really helped me through that. It was a distressing time. Those who've had it understand.
That's no joke, huh?
It's no joke whatsoever. But other ways to prevent, right? We were talking about the abs and talking about the core, talking about all these things. The good morning is doing is kind of the first step in that, in lifting something up from the ground, right? Lunge is getting something under your from under your sink. Very functional activities. And Dr. Cameron helped us get up a little bit taller, which is great. But at some point you need to do what you can to listen to your body. Okay, that's like the ultimate form of prevention. Aside from seeing a specialist for your pain, because how many people have you heard? Because I can actually attest with my practice that say, "Oh yeah, I was working in the garden a little bit longer than I should have, and I shouldn't have done that," and then something happened. My back went out. It happens, all the time. So listening to your body's the best prevention. Also, proper warm ups, cool downs, and stretching. Okay, making sure you're not just going for a run, that you're doing a little bit of movement prior to some of the things we did today. Nutrition, hydration is incredibly important, particularly for our aging adults. I can't stress the hydration part enough in that population. Engaging in a variety of activities and ergonomics, right? Stop slouching. Dr. Cameron, anything to add to that?
No, I think that was perfect.
I try. Other things, right? Making sure that you have the correct, alignment throughout your body. Leg length, I'm sure Dr. Cameron in a moment can speak forever about about various alignments. And of course, the strength and muscular assessments, making sure that again, the body doesn't typically do things for no reason. So if something's tight, it means something else adjacent is weak or not working as well as it could. So, of course, seeking out the knowledge, from people who have spent a lot of time and effort in this area. Dr. Cameron, do you have any quick tips and thoughts about hip alignment, leg length, and that kind of stuff?
I mean, it's just like you're saying, if something is out of position, even if it's pain-free for now, it's just a matter of time. It's kind of like your alignment on your car. If you have one set of tires that's offset, then you're going to see the wear and tear on that tire more so than the other three, right? And it's dosage over time or exposure over time that will reveal where your injury is going to be. Okay, so if we can get things in better balance, better alignment, get them in more of a neutral, good posture, then you're going to be set up with your body's going to be more durable and it's going to be able to handle more reps and you're going to have a higher quality of life.
Couldn't have said it any better than myself. Questions? Come on, we answered every single question in this presentation that you've ever had about the low back.
When you said that hydration is super important, how much do you recommend to drink?
Dr. Cameron, you want to take that or want me to take that?
Yeah, usually you're shooting for, so you go based off body weight. All right. So if you're, let's say we're just to make it easy, let's say we have someone who's 100 pounds. Okay. A teenager that's 100 pounds. You want to shoot for at least 50 ounces or half that weight in ounces minimum. So we want to try to get at least 50 ounces in And then if you can get an ounce per pound, that's great. You usually don't want to go above an ounce per pound because then you start to overhydrate.
Thank you.
Okay.
Yeah, agreed. And everyone knows that we need to be drinking more water, most of us anyways. And so I've found it's been very helpful for me in my personal life to figure out a vessel in a way where that I enjoy drinking water and will continuously sip through the day. And so, for instance, it's not the easiest thing to transport in a backpack, but it's just a Yeti with a straw, because I drink a lot more water through a straw than I will, through my water bottle. So, you know yourself and how you like to drink water, do more of that and figure out how you can make that portable to increase your chances of drinking more water, if that makes sense.
Yeah, it's such an important area too to make sure that you're doing, because it's a foundation for all your cells. Like the health of all your cells relies on you to be hydrated. Okay. And as we age, our tissues dry out and they start to get dehydrated, right? So if we can maintain that hydration, you're going to again have a higher quality of life and have more durability in your body.
Great point. Any other questions, y'all?
We must have been really thorough.
I guess that's what it was. It was mostly you, not me.
Get out of here.
I just bounced around. Okay, everyone, if you don't have any other questions,